Would you get on an airplane with a drunk pilot? Many of us fly through our days on autopilot with no thought of wellness. Join us today for a discussion with Dr. Olga on investigating your chronic stress leading to burnout. Dr. Olga is an integrated medicine physician. She's also an anesthesiologist by training. She studied Western medicine, Chinese, Japanese, and French medicines, and has passion for holistic approach to healing. All right. Now, Dr. Olga, welcome back. And we were hoping to hear your personal experience with burnout, if you had one and willing to share. And how do you manage stress as a physician?
That is very complicated story, I should say. Probably will take the entire time of the next 20 hours or so. But in brief, we need to understand that there's the people who are going in medicine altogether are people who are going initially for a call of helping the others, call of healing the others, and be, like these problem solver for many, many people. I frequently hear from the pre-medical students saying, I'd like to cure the cancer. I'd like to cure the heart problems or something like that. And we're thinking about how we're going to use all this wonderful technology and the knowledge and the research that the medicine is doing to fix the problem. But we don't think about that the problem actually starts way before we're starting to fix it. And we need to concentrate there. But let's return back to my story. After finishing my medical school, I realized that, medicine, conventional medicine or Western medicine is mostly fixing on the problem, but not on the cause, the root of the issue. And I felt that my toolbox is very limited. I needed something else. So I went ahead and got another diploma as a naturopathic physician, extending my knowledge into the herbs, manipulations, into the acupuncture, into the relaxation techniques, into the multiple other ways that Western medicine is not really including in its roster of the treatments. Later on, I realized that was still not enough, and so I was getting license after license. Meanwhile, working full time, which in medical field is never 40 hours, which by itself is too much actually. But 60 to 80 hours. At some point, I remember I calculated 110 hours of working when I was going through the residency. Pretty much no time to sleep. And then, honestly, we all thought to succeed. We are strong. We have to do it. And being a female in the field of medicine, in the field that traditionally dominated by male, pushes a little bit more of the intimidation and I wouldn't say desire, but need to impress, need to achieve onto the female shoulders. And so women have tendency to work more than male partners, and women have tendency to spend more time checking on the patients, talking to the patients, dealing with the medical records, and on and on and on. So overall, the life becomes your job. Your job becomes your life, and you become your job. Except your body is still needing some sleep, some food, some relaxation, some, your personal time, which never happens. And eventually, the system and organs give up, just like in anybody else. And so, yes, at some point, I actually woke up with a high fever that my body produced for no reason. I was not sick. per se. I didn't have any kind of infection or flu or virus or anything else. And it was very difficult to calm it down. I ended up in the hospital where my colleagues and friends were like scratching their heads, like, we don't know what's going on with it. And it took a while to get out of that, and caused quite some medical issues, which again, being a physician in the medical world, I had the access to the best of the experts who are well trained to fix the problem, but not look into the root. And so, patch here, patch there, let's give you this medication or that medication. And I realized that the whole pharmacy was prescribed for me, and I'm becoming the most famous patient in my own hospital because nobody knows what's going on. And that's where I actually stopped. I stopped. I took some time off. I pulled out all of my notes and read through the information that maybe was not that fresh in my mind, and start to heal myself with the help of my colleagues. I share with them my thoughts and understanding of the conventional ways of healing, and they mostly agreed with me. So all the prescriptions were canceled. I went on the holistic approach with the acupuncture, massage, Reiki, herbal therapy, and homeopathy. And I was back in a couple of months after that severe inflammatory response that my body developed to stop it. So that's my story of my burnout. But I can tell you one thing. I learned my lesson. I am doing my best not to overburden my body, my soul, and my spirit. And body needs rest, and body needs sleep, and proper good quality food and supplementation. If I indeed have to go through the very difficult times, like say for whatever reason I need to work more hours or I will endure more stress, I'm becoming proactive. I know I will need extra sleep. I will change my diet. I will change my supplements. I will plan to take the breaks and rest days, and I will turn my phone off on those days. And I will make sure that I have a friend or a spiritual guide in my journey, so that that particular time of extra stress, I'm not alone, and I am dealing with the problems properly, taking care of my body, my soul, and my emotions. And that's the only way for us to survive. We need to understand we are a very complex system. And one small change is not always fixing the problem.
Dr. Olga, I'm curious. It sounds like now you are very in tune with what's happening in your body, and you see the signs. So you know when you need to make a change and do something. Is that different for everyone? Do we all have different personal signs that we can learn to recognize so that we know when we're getting to that point that it's time to do something and make a change?
I would say I don't wish anybody to be in the situation that I were in. And the signs, yes, we all get the signs. Our body talks to us. We need to learn to recognize the language of our body, because it doesn't speak English or Chinese or Japanese or Russian per se. Our body speaks differently. If you don't want to get up in the morning, it's probably because you didn't have enough sleep. Okay, let's just stop here and think. What? Were you overstressed? Did you have difficulty falling asleep? Or did you have a poor quality of sleep? overall, you just designated yourself 3 to 4 hours of sleep a night because this is enough and I have so much to do. So let's think about that and figure out if this is correct way for you to behave. While we're very young, we think that we have a lot of strength. Oh, I could sleep like 2-3 hours and then I would be fine for the next day. We need to understand that our body has like energetic battery, and like the car battery, if we don't recharge it properly, it will burn out. The same airplane, like the analogy in your book, has the fuel and has the battery, and battery needs to be recharged. And so what do we do to recharge our battery? If we do 55 things and we just spend all of that energy, the life energy that is stored in our batteries, we guarantee to get in health problems. Just guaranteed. So recognize that you are not well already if you can't sleep. If you have a certain predisposition for this food, like I really like sweets, I can eat the box of chocolate at one time or something like that. This is not normal. So something is not right. Let's deal with that. Or say, I need to do this and this, but I have no energy. Your battery is low. Why? Recognize you are already not well. You are going in the burnout. Maybe you're not there yet, but don't get there. The other issue that is very common. I poured my bottle of water in the morning and I brought it back home, still full. You guaranteed that you were either super busy or super stressed that you forgot to drink. So again, this is another sign that you need to stop and think, what exactly is going on that precludes you from thinking about you, from listening to your body. By statistics, most of us adult people don't have first to forget to go and have a cup of tea or a cup of water or whatever drink we prefer. And overall, if you, like Masha told us, drinking more than 1 cup of coffee, and not because you just enjoy the taste, but because otherwise you are not able to move, that's another sign. Let's just stop right there. How many people are walking around with whatever the coffee cup in their hands in the morning? Well, I have tea here. Because they depend on it, because otherwise they cannot function. All right, what else is needed? And it starts very early, still teenagers, and they're already depending on the tea or some other stimulants, which are horrible for the body. Most of the time, they hurt much more than they help, but they give us that jolt of energy. What else? I need to go for a walk. I never exercise because I don't have energy. I can't find time to deal with my child's tantrums. I cannot find time to call my parents. Just say hi. Send them a little note. I never go to church because, oh, well, they're stupid and this is just waste of my time. I never talk to my friends except when I drive, and at the same time I'm getting distracted talking about something not important. La, 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 la. Nothing important said. I spend time with my friend. Is it a quality time? And so on and so on. There are lots of signs. If your life is not happy, your life is not normal, you don't have time to stop, you don't eat properly, you don't drink properly, you are going in burnout.
Yeah, and all of those lead to personality changes too. So if you have, an occupant in the house and they're getting grumpier by the moment, and they're not snapping out of it, it could be a potential, hey, let's go get some sunshine. You haven't been out of the house for a week. Those are excellent reminders, Dr. Olga.
Masha, I really appreciate this point. We do need to look around, because our co-pilot and his or her health, particularly mental and emotional health, are very, very important. And you might be actually the one to notice that him or her going in the burnout before they realize it. So maybe it is time to go for a slow walk and say, I noticed recently that you're not quite enjoying what you used to, and this is what I'm thinking about. And let's just hope that they're willing to hear.
Great advice. So, Dr. Olga, as a physician, most physicians that I've met, they're very passionate. It's obvious, you're very passionate as well. One of the things we talk about in our book is you do need to be passionate. You should love your work. You should feel like you are contributing. But sometimes passion without an intention, and particularly an intention to take care of ourselves, can lead us down, a dangerous path. What would you say to your medical colleagues? And it's not just physicians; it's nurses. Just recently, we actually met some clinical trials folks who are also very passionate because folks are burning out in medical research. So it's not necessarily just physicians. It's a problem throughout the medical field. But do you have any advice of, yes, you're passionate? How do you as a physician balance the passion and your mission, your purpose to help others with now, the realization, I have to take care of myself? How do you balance those two?
That is really
Maybe it's a mind shift. I don't know.
Yes, it is. There is one thing I would like to say right away. Physician or the nurse, surgical tech or nurse assistant, it could be medical research, it could be non-medical research. We're all in the same boat. I bet you that you were very passionate about the job you did before you got in the burnout. I bet Masha was very passionate about her job that she was doing before she got burnout. We all, if we are achieving something, if we're putting our soul, our heart into what we're doing, we're passionate. And so that's where we need to realize, and that's what brought me to a realization after my burnout, that passion doesn't preclude you from taking care of yourself. You just need to separate the passion for taking care of others versus your own life, and be passionate about yourself, because while you're healthy and strong, you are a productive member of society. You could be a passionate physician, passionate engineer, you could be a passionate teacher, you could be a passionate mom, you could be a passionate caregiver to the elderly or some other people who require some care. You could be passionate about anything you want to be. But once you're not well, if you got sick and your passion is causing this sickness, you will have to stop. And so you fell out of the grid of the helpers. Now you are the one who need help. You are the one who requires resources. You're the one who depends now on the other people. You're not a productive member of society. And that's okay if you need help. But it's better if you didn't get to that point. So 8 hours of work is really important limit. And it's not a good practice to take your work home or stay in the hospital extra time or stay at work at the computer extra time, particularly now that so many people are working remotely and nobody limits their time. So staying on the computer or doing the task throughout the night and then in the morning going for the next day, that's not okay. Yes, you're a passionate person and a specialist, but you're hurting yourself. And eventually you will hurt the same society you're working for right now. So this is just like taking the turn from look at me, how wonderful I am. Let's look at me, how wonderfully I'm getting us all in trouble. So let's realize that we also have responsibility, not only to ourselves, to our family, to our friends, to our society, by staying healthy. And
wow.
Overdoing it is never a good idea.
That's profound. Dr. Olga. I have never heard that before. Be passionate about yourself. I have never heard anyone say that. And that's a lot of food for thought right there.
It's work. It's work that requires your whole you to understand that your wellness is wellness for the others. When the mother is not feeling well, she is overburdened, she is tired, she has no energy, she has a headache, she is not, she doesn't want to talk to the kid. Who is suffering? Her and the child who needs his or her mom to run around and share some information and be happy and read that night story instead of I'm tired, you go sleep, shut up and just do something, go play with your toys. Who is suffering? Both of them. That is why it's very important to turn a little bit your mirror and think not only about, oh, I am so great at producing something, but what is on the other side? Who I'm hurting by being so great in producing something? And remember that you're not alone. You live in among the others who love you and care about you. But how long you can spend your life with them as compare how many hours you spend for work? What is your priority? Where is your heart? What is so important?
Dr. Olga, I think you have just caused a lot of breakthroughs in many brains who I'm praying are listening to us right now. And what a perfect way to sum up our flamed out session. You said that look at a mirror. So what really spoke to my heart just now is our listeners, a challenge to you is to take a look in the mirror, take a look at your lives. It's going to take a second and see the fruit that is growing in your gardens. What fruit are you gathering at harvest time in your life? And if it's the fruit that is sour or bitter or not good, well, this is your wake-up call. Time to investigate the root cause of why are you having the fruit you don't like in your life. And that is the signal to start investigating your pilot and your plane. Thank you, Dr. Olga, for helping us cover our flamed out session of our segment today.
You're welcome. And thank you very much for raising this important and, all encapsulating, all embracing problem. We all in the same boat, in the same place. So hopefully this will wake up some people.
Absolutely.